Hey class, my name is Christian Reyes. This is my Change Quality Management project. Class is Nursing 451, California State University, San Marcos, Dr. Alfie, and today is August 17th, 2018. So the project I'll be talking about is patient falls in a hospital. Um, Basically, falls is an aging process. It's inevitable. Um, as you grow up, you probably, as you become elderly, you'll be at a higher risk. But our main concern is preventing um, preventing any falls that can happen and minimize as much as we can. Issue identification. So the problem statement is that there are many falls that occur in the hospital floor that can be prevented. So some falls that can be prevented, for example, is providing a proper fall risk assessment, knowing all the risk factors, and slippery floor, something as such as slippery floor. Falls can cause injuries to patients and lead to more serious injuries. An example of this would probably be I had a coworker. Her patient actually fell in the hospital. She basically just fell on the floor, tripped, and she was a bit weak. Fell on her shoulder and actually broke her shoulder. So unfortunately, um, that that could probably been prevented by um, ass- assessing the situation and allowing help and maybe even a better flooring, soft or more compliant flooring. Quality standards. The CDC created STEADY to help healthcare providers prevent falls. So STEADY, what it stands for, is Stopping Elderly Accidents, Death, and Injuries. Some ways to stop that are just some tools to help educate you on identifying your patient as a high risk fall, knowing your risk factors, and then and basically just regular interventions such as a bed alarm or non-slip shoes. Each year, there's an estimated 700,000 to 1 million patients that fall in the hospital stay in the United States. That's actually a really good, that's really a high amount um, falls every year. And that's not even including how many injuries there are when a patient falls. I know in my hospital that I work at, um, last year we had probably a total of 25 falls, which was an improvement from the other year before. We've been doing interventions and different basic research basic evidence to help lower and minimize the falls. Patients are at risk for falls during hospital stay due to many reasons. So there are some reasons for them for being risk for falls is their medical diagnosis. Medical diagnosis can lead to weakness. Some medications can make them drowsy, which is making them a high risk for fall. Another reason would be just the equipment and the environment around there. On the picture on the right side, it's just talking about falls in a nursing home and hospital. Um, Falls are the leading cause of injury-related death in older Americans, non-fatal injuries in older Americans. On average, there are about 2.6 falls per nursing home residence per year, so about an average 2 to 3 every year in a home residence. And like I mentioned, 1,000 patients fall each year in U.S. hospitals, and 2,500 deaths per year due to patient falls, which is a really high count of deaths due to falls. Next is quality variance. Quality variance. Increase in falls due to no assistive devices. Basically, patient has no walker or patient has no cane with them that led to falls. Not enough hourly rounds to check on patient. Um, just checking on a patient each hour helps helps prevent falls, knowing that you're when they need to use urinate, you could help them. Um, Call light within reach. If there's a call light not within reach. If the call light is not within reach, patients probably reach over or to try to do their own things. Just having the call light allows them to call for assistance. And then use of the fall risk assessment. Providing a fall risk assessment is important, just showing that you're able to assess each patient if they're a low, moderate, or high risk. So performance standard, what we want to do is want a use of special flooring compliant to help lower incidence of falls injury. So there are some special floorings that could be implemented in a hospital to help prevent falls due to slipping and flooring that is soft. So in case you do fall, it allows for a softer landing. There is increased observance of high-risk fall patients. So putting the patient next to the nursing unit can help. Also, just rounding on the patient as much as you can. Having a bed alarm presence for patients is also important. Just because if they are at high risk, we could hear whenever they try to get out of bed, and we'll go there as soon as possible. Non-slip soccer shoes to prevent falls is also important, due to some falls being the causes them slipping or having the wrong kind of shoes or slippers. Root cause analysis. Some root cause analysis is they did not perform a proper risk fall assessment. Patient items are not nearby, which could lead them reaching over and doing it and falling and standing up by themselves. Safety alarms are not present. Non-use of non-skid footwear. Improper communication during report. Not telling your nurses or CNA that they are not that they are a risk. Just letting them know is good and communicating. The environment, the equipment around could be an obstruction to the patients. High-risk fall patients not placed closer to nursing unit. Indications for high-risk fall patients, just knowing that, and also not enough staffing. So the people that are at high risk of falling are someone that had a fall within the last 6 months, someone with poor vision or dizziness, someone that's unsteady and has difficult walking, and someone that takes more than 5 prescription meds, especially if they are psychotropic. So scope of harm: is it the nurses? Is it the patients? Is it the system? Is it staff? Is it equipment, or is it the environment? All those could be, it could be a problem for each person or all together. Key stakeholders. The key stakeholders are the registered nurses, CNAs, any other medical professionals working in the hospital, managers, and a director. Solution implementation. So according to LeCant, compliant flooring to prevent falls-related injuries can and help lower risk of falls and slipping. So that could be done by implementing some new floorings in the hospital. By Sheng and Yin provided adequate caregiver information and continual observation. Just providing better communication and observation can help prevent falls. Individualizing risk of falls and care for each patient is another one. Just knowing each patient is different and individualizing each of them is important. Next is providing shock-absorbing floor to prevent injury. Basically, if there is a fall, having a different flooring that is soft can help prevent injury. Next is analysis. You want to recall and reevaluate all of the falls present after all of the implementation. So we want to see what was the reason for the falls and how we could prevent it next time. Next is perform surveys to see any other risk of fall in the unit, just rounding and seeing what risk in the unit can cause a fall is important. Measure how much falls were present after implementation for 3 months. So seeing if the implementation that we used was useful and if it helped decrease the falls. Next is have education provided to workers on ways to prevent falls. Just providing teaching to them and can help prevent falls. Hourly routings to assess each patient for their falls is an important one. So our next steps. Our next step is if falls are continued to decline, we want to continue implementation of the special flooring on the unit to lower the incidence of falls. We want to provide regular education classes for fall risk patients. Um, Proper communication with workers, and continue keeping track of falls on the floor. So if falls continue to increase, we want to implement a change on the new flooring, have meetings to discuss the different many risk factors, and keep track of the reason for the falls on the floor. So basic main thing is we want to prevent falls in the hospital. Lastly, these are the reference I'd use for this project. All right, thank you.